Okay, very good afternoon to everybody after post-lunch session. We are all relaxed little, right? This topic is a little bit different than the pharmacology as such, right? I have been, first of all, I would like to thank the organizers for giving me an opportunity to talk on this. Many of you being a doctor or the health sector working, this particular topic you may find important for yourself and your family too. So, last few decades, this has become a very relevant topic nowadays. Earlier, the type of disease which used to come across was a communicable disease, infectious disease. But last 3-4 decades, this has become a very important topic. And because not only the patients, but we doctors and working on the health sector also suffer from this type of lifestyle disease like cardiovascular diseases, diabetes mellitus, hypertension, cancer, and all. If you look at it, these 5 major diseases takes almost 70% of total mortality. I'll give it to both Indian, because I belong to the India, so what is an Indian scenario now? And how does this affects the global economy and Indian economy? The life expectancy is definitely reduced because of this particular 5 major diseases. And the burden of economy is very high because of this particular 5 lifestyle diseases, amounts to almost $237 billion. It's a huge money. What about the USA? More than 70% of deaths and 75% of healthcare spending costs attributable to chronic 5 leading diseases like heart disease, cancer, chronic liver disease, respiratory and cerebrovascular disease. More than half of all deaths in 2009 was because of these 5 major diseases. More than 50%. And there is a huge nation cost on spending on this disease. Not only the mortality, but disability, quality of life, all is affected. What is the recent study in 2009 which was published? More than 196,000 to 40 adults were screened out around age of 25 years or older. And they found that this severe heart attack, angina pectoris, stroke, cancer, which much increased than the previous few years prior to this. 63.6% of participants did not have any of these 5 chronic disease when it was assessed in 2002. But in 7 years span, they have increased to a huge amount with a high p-values. Almost 23.4 million to 30.9 million population were suffering from disease. So what has gone wrong in last 1 decade? So the conclusion of this study shows that 1 or 2 or more leading lifestyle related chronic conditions increased steadily from 2002 to 2009. In India, if you see, 60% of world's cardiac patients belong to India. Almost 4 million Indians are predicted to die due to heart disease. There was another study which was very important, which has been done only in physicians. This was published in 2009. There is a journal called Journal of Association of Physicians of India. They found that the doctors particularly have a higher incidence of lifestyle disease rather than the normal population. This is very alarming because they said doctors had a high prevalence because doctors do not take care of their own health. They never talk about the other patient's health and other economies and the research and academics more, but as come to their own, they are very poor manager of their own health. Why these lifestyle diseases? You all are aware, I'll just keep fast in this topic, but just to summarize this, these are some important risk factors. Stress is a major risk factor. Pollution, lack of exercise. If you talk just to make it lightly, how many of us do a regular exercise? Don't answer me, but yes, few of us do it regular exercise. Then radiation exposure, mobiles, we carry mobiles. Even the mobiles, we keep it near our way of sleeping. So you might have received lots of messages and video how the mobile radiation can cause damages. Particularly the brain cancers, the increased incidence. Hereditary, sedentary habits, food habits, the type of food we eat. And on top of it, yes, smoking, alcohol, etc. is adding this. So what's going wrong? absolutely everything has changed. Because today we are running for a time. Money and success is everything for us now, rather than our own health. Extending working hours. We were just talking today with a colleague. That's what happened. We are doctors, particularly both husband and wife are working. We hardly have any time. No time for relaxation. Very few people go for outing and doing everything. And hardly very few people do the exercise. And on top of it, lot of stress. Stress is basically what is it, how does it responsible? It causes a flight or fight reacts response to the human body. And this causes a lot of mental and physical stress. But ultimately, what does it lead? Ultimately, this leads to the high blood pressure, diabetes, heart disease, peripheral artery disease, stroke, etc. But the major, if you boil down to this, all these causes which I enumerated, they lead to basically a substance which is called free radical. All of us, you must be very aware about it, but we don't pay so much attention to this free radical. Free radical is the major component which is causing damage to our own health. How does this free radicals get generated? When we eat food with oxygen, it leads to energy and CO2, and there is a compound free radical which has got a less electron in its outer structure, which is an unstable compound which causes the damage, right? Look at this particular pictorial things, whatever, whether smoking and other thing, even ultraviolet rays, industrial pollutions, all those things releases the free radical which ultimately causes damage to the human body cells. The unstable compound or this free radical tries to damage the cell which is a stable compound, tries to take an electron from the outer structure and destroys the cell. This is the basic mechanism of all these causative factors responsible for the lifestyle disease. Wherever it attacks, it causes damage. So mental stress causes extra load on the heart. Now let's talk about the two important which I am very close to, heart disease, right? Why I am standing here today, maybe only few of us are here, but today I being a physician in internal medicine practicing at the age of 75 years, my father who was a marathon runner used to walk 10 kilometers per day, used to cycle, had no hypertension, no diabetes, never smoked a cigarette, nothing, very simple man. But at the age of 76, I lost him because he died of sudden cardiac death. Unfortunately, today is his death anniversary, I am standing here. Why I lost it? Being a physician, why I could not take care of my father? But boils down, it's not me or you. It's what is the mechanism why it's happening in the society. Why some of the people dies of sudden cardiac death. It's very common. Many of you might have seen your colleagues developing something. In India, it is like 1% dies every 33 seconds due to the heart attack. It's good that it is said a good and kind heart is nice, but whether that is important alone or keeping a healthy heart is important, equally both, right? What is the disease profile in the worldwide? Russia tops, but nevertheless, USA, Canada also stands somewhere where patients and physicians also developing cardiac diseases. Some of the facts that according to the recent trial study in 2010, due to aging and population growth, the annual coronary vascular disease events in China is very, very heavy, right? A staggering 200 million Chinese have higher blood pressure. Those who used to be said that Chinese used to have because of their lipid mechanism, which is low lipid levels, they never used to develop a cardiac disease. But this is what happening because they are heavy smoker. Same thing about the United States. Almost close to 1.5 million people which was there had this type of disease in 2001. But see the census, what is talking about. The Indian population has grown up to 68%, and particularly young population is suffering from cardiac disease, right? So there are various studies which quotes, and if you look at this data in the USA, Asian Indians tops the list amongst others, but other people are also higher risk, right? One thing that those people who are staying in the cities and town, they are more prone for the heart disease because of a lot of factors, pollution, stress, and etc., right? Now see the estimated additional 45 millions fall into the pre-hypertensive. Many things which I don't know whether you check it yourself or not, But this particular entity, which we consider pre-hypertensive, you usually do not bother much about it. But what is now suggestive that just take care of pre-hypertension at the very beginning so that you don't develop a hypertension, so that you don't develop a coronary artery disease possibility. But 45 millions of people are having the blood pressure which is called a pre-hypertension. By the newer guidelines, pre-hypertension is where the patient has a blood pressure of 139 to 80 to 89. 120 to 139 is systolic and 80 to 89 is diastolic. Why? Because there is a 4 times greater risk of developing hypertension in this patient and coronary artery disease later on. What about a woman? Earlier, before the menopause, it is said that women do not develop a coronary artery disease. But things are changing now. 10% of women between 45 to 64 years and 25% are developing heart disease. Even nearly 13% of women over the 50 years have had a heart attack. This is surprisingly a very big fact because many of the things, smoking is the most important risk factor associated with this. So there are certain unchangeable risk factors you all are aware. I need not have to mention age, sex, race, family history. But some changeable risk factors which we need to take care of: hypertension, abnormal lipid profiles, obesity, diabetes, physical inactivity, cigarette smoking, and alcohol intake. I'll not go into this type of lipoproteins is considered to be one of the particularly VLDL and LDL. HDL, high HDL is considered to be a protective mechanism. So I'll skip these 2 slides. Right. As you know, not all cholesterols are bad. Some cholesterols are also good, like HDL. Obesity, not only a total obesity, but type of obesity, central obesity, what we call pear of apple type. Which one is? Yes, central obesity is more responsible. You might have seen this picture in yours earlier, this thing, that how does the coagulation responsible or atheroma formation or plaque formation occurs, because this all depends on the free radical. Recently, various studies have done that cholesterol is not the responsive for developing of atherosclerosis, but diseases like chlamydial infection, stress, smoking leads to atherosclerotic mechanism and causes this atheroma formation and ultimately clogging of the artery. Physical inactivity and cigarette smoking. This is very important. If you want to reduce it, change the lifestyle, quit the cigarette smoking. As we were talking about the moderate to intense physically, better to do it a brisk morning walk, 20 to 30 minutes, and as we said, post-dinner walk, just 15 to 20 minutes is very important for reducing your blood pressure as well as decreasing the cholesterol and taking care of the diabetes as such. Right? One important finding which has been noticed that most of the time heart attack develops at 4 a.m. in the morning till 10 a.m. This is called an early working hours problem, right? Another fact, diabetes, be aware, they develop a silent heart attack because of neuropathy problem. The best point of heart attack is 90% is preventable. This word is very important. I will not talk about the treatment of it, but most important, preventable. How? We will go ahead and find. Primary prevention by stress reduction, lifestyle modification, regular checkup. Then secondary prevention means once you have some type of angina, even you have not developed an hypertension heart attack, the prophylactic aspirin is very, very important. And cholesterol lowering agent. There is some dilemma about this cholesterol lowering. How much is to be taken, what cholesterol level has to be kept, but atorvastatin or rosuvastatins, these drugs need to be taken once you are found to have a hypertensive with atherosclerosis. Right? Regular checkups like regular exercise testing, stress testing, or lipid lowering profile, lipid profile, and screening for diabetes is very important. So my mainly saying is how to prevent it. Diagnosis, yes, there are various modality of diagnosis. CT angio is the best, or contrast angio is the gold standard. But coming to the solution, 4 important: decrease the stress, change the diet pattern if you are taking a high fat diet or high carbohydrate diet, control the triglyceride and other thing. Food rich in fish oil or omega-3 are very good. Omega-3 is found to be very, very effective in reducing the cholesterols. I'm talking of we are those sitting in the pharmaceuticals conference, but my focus is, yes, it is important. It has pharmaceutical industry have changed the profile of management, what we used to manage 10 years before, like rheumatoid diseases, SLE, nephritis, connective tissue disorders, Even the malignancy, pharmacological therapy have changed it. But we have to understand the natricuticals is really very important and one must focus. Diabetes mellitus is a very high incidence all over the world. USA is one of the important country where the diabetes is rampant. Almost 190,000 deaths in 2011, 2.263 million disability adjusted life years. Huge major problem in the world. That's why you can see there is another conference going on glycobiology. More attendance is there rather than this conference. So diabetes is a very popular subject. Many people choose that topic. Okay. I'll not go into detail of this particular, how it causes it, what are the types of diabetes, you people all know very well. There are different in Asians like MODY and LADA are very common in Asian setup. Then there's secondary diagnosis. I'll not go into detail of it because you are well read about it. But what is important that one must understand the diabetics, the complication. We call it as a sugar as a slow poison. It has an immense capacity or capability to cause damage of almost all organs, be it a limb, be it a kidney, eyes, heart, anything, name any organ, diabetes is going to cause a problem to them. In diabetic nephropathy, the incidence is very high. Diabetic coronary artery disease is very, very high. So even eyes are not spared. So the chronic complications like angiopathy, retinopathy, nephropathy, neuropathy, and skin problems and infection. The role of us to this audience, I would like to say, diabetes, the major role is again exercise and nutrition. What diet you are taking. Cut down the carbohydrate, preferably during the night time, take less carb. Take more of protein, but better to take more of fruits and vegetables and skip your carbohydrate and protein in the night. That's very, very important. So calorie reduction but from the carbohydrate, and take as much as essential fatty acids which can reduce the diabetic and work on insulin, right? Collaborative approach in patients is very, very important. Patient teaching, exercise, nutrition therapy and drug therapy, and self-monitoring of blood glucose, right? To just summarize this whole topic of lifestyle disease, we all are working and we work for money beside our own passion. Just take out the money from your passion. How many of us will ready to work? I don't know, but this is one. But is the money important only for our survival, or use the principle of earn? Because health has to be earned, it cannot be granted. God has given good health, but we have to earn to maintain that. And the same principle applies, nothing new about it, but exercise every day, 15 to 20 minutes walk is must. Positive attitude, yes, very, very important. You might have heard about it, that if you maintain a positive attitude, talk always good about somebody, give a good compliments. This is a common, but this is very, very important. Speak something good. Positive attitude helps you to maintain 7.5 years of quality life. This is proven fact by the scientist. Rest, adequate rest, evening 6 to 8 hours, absolutely sound sleep, without tension, forget about tomorrow's tension, just relax, have a good sleep is very important. Last but not the least, the pillar of is the nutrition. To just increase the protein intake, reduce fat intake, use omega oil, CoQ10, garlic, green tea and antioxidant. Why I am saying the nutrition is important, just look at it, because this is the overall approach is required, healthy lifestyle. But before, why are we eating nutritious diet? Just ask yourself, is the quality of food we is good? Does it contain all the necessary vitamins, minerals as per the optimal dose of recommended daily allowance? RD has a broad spectrum, minimal and optimal. Which one are you following, a minimal one or optimal health? Because WHO and Indian Council also has suggested there is a 40% nutritional gap. We are all eating, say, well, putting a good structure, but is that the nutrition going inside? Because I would like to suggest you 2, 3, 4 books which help us to understand how the free radical causes damage and what is the role of nutrition. These are the 2 important books which I have gone through. One is, this is written by Dr. Ray Strand. I would suggest must read this book for every person, whether being a physician, health sector working, or a layman. What your doctor does not know about the nutritional medicine may be killing you, But Dr. Ray Strand, he is a US-based physician, had 35 years of clinical practice. His wife was suffering from one disease which is called fibromyalgia, had shown it to endocrinologist, channelopathies, no response, worked out in, found it out that food supplements had helped it, and then after 7 years of publication, he produced this book. It's an amazing. Then Secret of Supplementation by Gloria. She says that what nutritious food, what apple or fruits we eat does not have a nutritive value unless it is plucked directly from the tree. So these 2-3 books, Fighting Body Pollution, Supplement Your Prescription, Antioxidant Miracles, these are some books which has helped us to maintain. Why I'm standing today? Because I used to be an asthmatic, I used to be on inhaler, I used to be on bronchodilator drugs. Till I read that previous book, and then I realized there is an importance that we can definitely be prevented. I'm off my bronchodilator, I'm off my steroids, off my inhalers, all because I started following some naturopathy, which had helped me a lot. This is my humble suggestion that just go through it so that maybe this talk will help you, some of you or your patients or your relatives to take care of their own health. At last, but not the least, I thank you all for patiently listening. Thank you very much.